This video is to show you how to perform a renal ultrasound exam. The exam consists of 6 views. Beginning with the right kidney, place the probe on the patient's side so the indicator is pointed towards the head of the patient. Rock and fan your probe until the kidney comes into view. You can use the liver as a guide to help you find the kidney. In this view, you should be able to identify the renal medulla, renal cortex, and liver. You should also be able to identify Morrison's pouch and if there is any fluid hiding in that space. Keeping the kidney in view, rotate the probe 90 degrees counterclockwise so that the indicator points to the bed. Fan up and down to visualize the entire kidney in the transverse view. Repeat these views for the left kidney. The left kidney can be tricky to visualize, and you may sometimes need to put knuckles to the bed to help find it. You may also need to angle your probe through some rib spaces in order to fully visualize the left kidney. Hydronephrosis is an important finding on the renal ultrasound exam. It may appear as a large anechoic area indicative of fluid, or as decreased echogenicity of the renal medulla. The last views in this exam are of the bladder. Begin with the indicator of your probe pointed towards the right hand of the patient. Fan up and down, sliding downwards until the bladder comes into view as an anechoic space. The bladder wall appears hyperechoic, whereas the fluid inside the bladder appears anechoic. Changes in the echogenicity of the contents of the bladder could indicate sediment or other findings. In women, you may be able to use the bladder as an acoustic window to better visualize the uterus. To obtain the long view of the bladder, rotate your probe 90 degrees so that it is facing towards the head of the patient. Fan back and forth to visualize the whole bladder. An anechoic space behind the bladder in this view may be indicative of free fluid within the abdomen.